Hey y'all, so as you can tell by the video, I am going to be giving you 5 reasons why I feel like you shouldn't be a nurse. However, because I do not want this to be a negative video, I'm going to give you an upside to each of those things. I feel like I kind of got bamboozled in nursing. A lot of things I did not realize was going to happen to me, and so I don't want that for y'all. But however, if somebody would have said, you know, it gets easier or it gets better or it's not as bad as it seems, it would have made the load lighter for me. So let's get into those 5 things. So the first one I'm going to talk about is if you already have anxiety, you will have it even more as a nurse. I think we understand, or at least I didn't understand, that I am going to be on high alert all the time. I am responsible for somebody's life. I am responsible for keeping somebody stable and or keeping somebody stable who might have crashed and keep them from dying. That is a lot of responsibility, and I didn't realize how my nervous system was like on high alert all the time. It would feel so weird because I would be having a good day, I'll be good, like maybe I had a long week off, and the moment I step into work, instantly I feel anxious. Before I even got report, before I even knew what my patients were looking like, just stepping into that setting made my anxiety on 10. And I'm just like, I couldn't figure out why. And in therapy, it was like, because you have to be on high alert all the time. Like, you have to pay attention to even the minute things, like if somebody should or shouldn't be eating, what they should and shouldn't be eating, symptoms that may be showing that somebody is crashing. Like, you have to pay attention to everything. That will put your nervous system on 10. There are millions of different things that you have to watch for that could be the difference between somebody living and somebody dying. And that is a huge responsibility. Like, I feel like that would give anybody anxiety. And although it is normal, I do want y'all to realize, like, it doesn't stay that way forever. I don't think we realize that. Like, we think like, oh, when we go home, like, oh, we're fine. But then you're thinking of things that you may or may have not done, even after you have left the job. So if you are a person who has anxiety, I feel like it's going to increase your anxiety, because that's what it did for me. And if you don't have anxiety, I feel like it's going to bring some level of anxiety up, especially if you are a new nurse. However, the upside to that is the longer that you become a nurse, I don't want to say the easier it gets, but the more familiar you become with certain signs and symptoms and processes and just how things work in general. It just gets easier in that form. You know, you'll be able to, somebody might be in respiratory distress, and as a new nurse, you're like, oh my God, what do I do? How do I do it? But as you get into it, as you go through the process longer, it becomes like second nature. So I don't want y'all to feel like you will always have anxiety or you will always be on 10. I still have a little bit of anxiety, especially if I'm starting like a new contract, because I don't know the people, I don't know the setting, like I don't know the acuity of the patient. So that's like a normal nervousness, a normal anxiety feeling. But after a while, it starts to fade. So I don't want y'all to think that you're gonna constantly have this anxiety. At least you shouldn't. Once you get the hang of it, and unfortunately, it might take you like a couple years for you to really get your footing and feel comfortable. But again, I always tell y'all, don't be afraid to ask questions. There is no dumb question. You are in control of somebody's life. There should be no reason why you are afraid to ask a question. And if somebody make you feel dumb, professionally check them, because they were once too a new nurse. So that is my spiel on that. Next thing we're going to talk about is multitasking. I say now, if you are not a person of order or you do not know how to multitask efficiently, it is going to be difficult for you when you get into the hospital setting, because you are doing a million things literally at once. You can step into a patient room and you're automatically going to be assessing them. You're going to be listening for report. You're going to be listening to what they are telling you. It's going to be so many things that you are just looking at all at once. And if you don't know how to multitask, I feel like it's going to make you fall behind. Now, granted, as a new nurse, it's going to take you a good amount of time for you to get in your flow, your feel, how you want to do things, how to assess patients and look at acuity and what patients you should be working on first. It's going to take time to gain those skills. So I don't want you to think that this is a end all be all. Like, if you can't do it now, you'll never be able to do it. But what I do want you to do is be patient with yourselves. That time that you have to precept, when I say milk it to the core, if you don't got a good preceptor, do not be afraid to ask for another one. But I will say that you need to have some sort of organization going on to make your shift flow. It's not going to always flow, because we're dealing with sick people. Anything can happen. Literally, it always, like, at the last minute somebody ends up coding. That's just dealing with life. But if you have certain things in order, like maybe a report sheet, you have that where you already know everything about your patient, so that if they code, all you got to go do is look at that paper. You don't got to be flipping through papers or anything like that. Use that. If you have a certain way, like when I come in for my shift, after I get report, I don't have to go in with the nurse, but after I get report, I will go say hey to all of my patients, because I just want to see what you look like. I want to get a feel for what you're going through. Sometimes patients may look bad on paper, but when you actually get in the room, it's like, okay, it's not that bad. So I always go introduce myself to my patients right after I get report. You know, then I look over the things that I may have missed in report or may have not been said in report. You know, I have a way that I do things typically every single day. Now, I'm not saying that every day those things will go as planned, but I know that when I come in, I'm doing this. By the time it's 8 o'clock, I've done that. From 8 to 10, I'm passing my meds. From 10 to 12, I'm charting. You know, like I have certain things set in place so that my shift kind of flows and I'm not just all over the place. So once you get your footing in nursing, like once you do it long enough, it will get easier. But I will say, if you are in nursing school, just try to be organized there. Start there first so that when you get in the hospital, it won't be such a huge shock. The next thing I am going to talk about is you will not be financially compensated as a new nurse. It's just not going to happen. Unfortunately, we are not paid adequately, and I could not tell you why. I don't, because we do a lot, but for whatever reason, companies and hospitals don't seem to think that we need to be paid adequately. And so I don't want you to be bamboozled. I'll link the video, but when I got my first check, I was so confused. I was generally confused. I was only making I believe it was $200 extra than my job that I had left. And I said, I went through all of this for that? I just put in 2 weeks of work and this is my check. And so I don't want y'all to be surprised, because for whatever reason, I thought the nurses make really good money. Now we can. There are so many different areas of nursing that you can go into. I'm specifically talking about the hospital. If you are going to do bedside, do not expect to have a big fat check. It's just not happening as a new nurse. Now, once you go into certain specialties, or maybe you become a travel nurse, or maybe you just don't do bedside at all, you find something completely different. But as a new nurse in a hospital, unfortunately, you'll pay. Now, it also depends on perspective. Like, I was making okay money, but if you're coming from making no money and now you're finally getting a check, it might mean the world to you. So it is all about perspective, but I think it's a general consensus that nurses do not get paid what we deserve. And so that's what I want to relate to y'all. Don't be surprised if you feel like I'm doing all of this work for this amount on my check. It's either like we're asking for too much money or we're wrong for asking money. I don't know why. What is that? Why is that attached to only nurses? Like, it's not attached to that with doctors. Like, we go through just as much, like the rigor, not only even in school. Maybe our schooling was still intense for me, but when you get out on the floor, it's a completely different ball game. And I don't know if it's like that in medical school or whatever school, maybe as a lawyer or whatever, but I just don't know why like we are bashed for asking for what we are worth. That's so weird to me. But when I say don't be afraid to ask for your value, do not, and don't let anybody make you feel bad for asking for what you're worth. So the upside to that is nursing is so diverse. When I say it's probably the only career that is diverse as it is, I mean, you can go into, it's more than just bedside. They just teach us to either go into the hospital or nursing school. I mean, it's been maybe 6 years since I've been out of nursing school, so I don't know what the curriculum is like now. Like if they are putting more things out there to do outside of like bedside. But when I was in nursing school, that's not like so old, but when I was in nursing school, I only knew about the hospital, teaching, and a nursing home. But when I say nursing is so diverse, there's so much you can do outside of bedside. You can do tech. Like, there are a lot of nurses getting into tech now. You could do aesthetics. That's something that I am into now. You could be an entrepreneur. Like, there are so many things that you can do. Now, you may not have to find your footing and find what you like and what fits for you, but I always say that there is no reason why you should be miserable in nursing, and there is no reason why your pay cap should be limited, because literally there is so much for you to do. If you don't like something, then move along to the next. But to stay in a field that does not make you happy or is not compensating you accordingly, I feel like there's no reason why you should be doing that when you have so many options. So that is the upside. Initially, if you start out in the hospital, you won't get paid according to your workload, and that's normal. But once you gain your skills, I plead with you to go try different things, go get your feet wet, see what you like, and then if whatever you like, just go hard at that. The next one is, if you are not good with overtaking others' problems and issues, it will become a problem for you. And by that, what I mean is, in nursing, you get overloaded with things that I don't want to say are not within your scope of practice, but I guess not within your scope of practice. They don't teach you how to deal with patients' emotions and their family issues and their finances. They don't teach you how to be a case manager. These are all things that as a nurse, they're not in your job title, but they're going to come up every single day. I can't tell you how many times like patients this dropped on me this load about what's going on in their family or what's going on in their life. Patients are like, you know, I don't have a home or I don't have running water, and then you have to be the advocate for them and let the case manager know, because maybe they didn't want to tell them or they felt embarrassed, and maybe you just came in and they just felt comfortable telling you. So now you have taken not on the responsibility, because it is somebody to take on that responsibility, but you have to be the one to initiate it because they did it in the first place. You know, you have to be a financial advisor. There are so many things outside of nursing that you have to do as a nurse that they do not teach you about in nursing school. And if you are the type of person like me who gets overwhelmed really quickly, and also I'm an empath, so it really did not help. But if you are that type of person where somebody tells you something and you feel like you take it on too, like it's your problem too, I will say in the hospital, it gets even worse, because every single day you are dealing with people who have problems and you don't know what their problems are. But people get in a very vulnerable state when they are sick, and they just start to open up to you, and it's inevitable. On the upside of that, you will learn to detach. You will learn to empathize and sympathize, but the moment I walk out of those doors, my patients are at home. Now, I'm not saying, my patients are at the hospital. I do not bring work home. Now, I'm not saying that there are moments where I'm like, you know, maybe something hit me really hard or touched me and I'm not thinking about it. But for the most part, when I'm out those doors, I am out those doors. Do not call me. I'm not thinking about work until I have to step foot in there. And that will come with time. It came with time for me because I am a highly sensitive person. But I had to learn that it was draining. It's draining to be at work dealing with these problems and then also bring them home. So I had to create boundaries with myself. And that's what you will learn, that you have to create a boundary with yourself. When you are at work, you are at work. Everything and anything that needs to be handled can be handled at that time. So you'll learn to detach as you become a nurse. Everything does not need to be brought home with you. Again, you will take on a lot because you are with someone in their most vulnerable moment. And a lot of times they don't have anything to do but sit and think. And so when you come in there, they just start offloading. You know, my mama didn't die. I don't got no money. My kid is in jail. Like, so many things that you are just like, whoa. But you will learn to sympathize, empathize, and then detach once you walk out the door. So it's not as bad as it seemed, but it was a lot for me because I would start to take on those problems. Like, I would feel like I am going through them, and I would be wondering, like, why am I so drained and I'm not working? And it's because I'm thinking of my patients while I'm off. And I had to say, no, we got to stop doing that, because you can't be drained at work and at home. So just learn to detach. Okay, so the last thing that the last thing that I want to talk about is something that is the reason why I went into nursing. I'm an animal person through and through. I really don't even deal with people like that. And so when I was changing careers, because nursing is my second career, I was like, what is something that I would love to do that still is near and dear to me? And so medicine and health, I really enjoy that. So I was like, you know, why not be a nurse? I was quickly informed just by my experience that nursing is a business. It is not a let's help you so you don't have to be back in here type of career. And that was very shocking to me, because outside of nursing, like, I never had been in a hospital. You know, I didn't have friends or family or relatives that were in and out of the hospital. So I never knew what the actual setting felt like. I just viewed it as when you go to the hospital, you're there to get better and never come back. But that is just not the case. And the reality is, again, nursing is a business. If it doesn't make dollars, it doesn't make sense. And so when I say that, you'll deal with things like patient overload. They don't care about patient safety. And patient safety and patient care is not as of a big deal in the hospital as it is in school. Now, granted, there are anomalies. There are great hospitals out there who do not overload their nurses with patients, and they really care about the patients getting better. But for the most part, I've never been to one, and I've been a travel nurse for the last 3 years, and it has been the same thing over and over again. If they need to fill a bed, but they don't have the nurse ratio to fill that bed, they don't care. It just is what it is. You know, I noticed that a lot of medical professionals they're not educating patients in the way that I feel that empowers them to take back their health. It's more like, take this pill, do a little this and that, and then whatever. But patients, I don't think, understand the severity of what is going on with them. And granted, that's your responsibility to know what's going on with you. But I just truly don't believe that patients are expected to get better and then not come back, because I see a lot of repeat patients. And I had to learn too that if you don't care about your life, I can't care about it more for you. Like, I can't want it more for you than you want it for yourself. And you'll realize that you'll run into a lot of patients like that, where they think, oh, I could just take a pill and I could keep living the same life that I was living and got me here in the first place. And that can be very frustrating, because it's like, why are you here again? Why am I seeing you again for the same stuff? Like, why do you want to live this life? Like, I don't even want to be here to work like that, because working in a hospital could be very depressing. You're dealing with sick people. I mean, you do have those moments where, you know, people get better and they are really advocating for themselves and they're really taking it serious. But for the most part, people are a revolving door. So I'm just like, I don't understand the disconnect. It's like, why would you want to be here? Like, you could be out living your life, traveling, whatever. Why would you want to be in the hospital being sick? Like, why wouldn't you be taking back your health? And at the end of the day, nursing is just a business. Okay, as much as I would like to believe that, you know, Western medicine and just working in the United States is about making people healthier, it's not. It is a business, and if it doesn't make dollars, it doesn't make sense. And I had to be okay with that, because that's why I went into nursing. I went into nursing to make my patients better, to educate them. And so that's the upside to it. You know, you do your part. You can't worry about the rest. When I go in with my patients, I'm always educating them. I'm always telling them. I get patients all the time who do not know what they're taking and why they're taking it, and why they're taking 80 different blood pressure medications, and why they should be asking doctors the questions. When you go in, you do your part. That's all you can do. You can't take on the responsibility of the world. One person is not going to change this business. So I had to look at it as, because it kind of got discouraging. Like, I'm thinking I'm about to go in and make a difference, and I'm not really making a difference. And so I just had to train my mind to think, you do your job regardless. You go in, you educate, you always be positive. I'm always the nurse who, like, I'm not gonna sugarcoat anything with you. I feel like I'm getting patients who are younger and younger, and I go in there and I'm like, what are we doing here? Like, this is the life that you want to live? Like, this is how I'm talking to my patients, because I'm not about to play no games with you. I don't want to see you in here. And sometimes it may come off, it's harsh, but it's really just tough love. And I've never got a patient who, like, fired me for how I talk to them or anything like that. If anything, they're a little bit taken aback by it, because they like, the doctor not even acting like they care about me in this sense. And then here you come in, you basically checking me and saying, like, you need to get your life together, because this is serious. You're too young to be having these issues. You need to make some lifestyle changes. If you have children, you may not be here from them. You know, you may not be here next year. Like, if that's the life that you want for yourself, okay, fine, cool. I'll leave it alone. But if you want longevity, if you want to operate at your highest potential, if you want to be here and actually be active and feeling good, you need to make some changes. If they are going down for a surgery or they get on new medications, like I know sometimes the doctors come in and sometimes you'll have multiple doctors coming in and it could be so like overwhelming. And one person is saying this and another person is saying that. Ask them, slow down. Explain stuff to me. Break it down in layman's terms. I always tell them, record the doctor. Record exactly what the doctor is saying so that you could play it in your head or you could play it over and then write down your questions. I say that all the time. If you need a pen and paper, I mean, we got phones now. Write your questions down. That is your time to have with the doctor to get off any concerns, to question any type of medications. What is the plan of care? Who is on your team? Like, you have to advocate for yourself. And so I say all to say, do your part. I come in, I do my part. I'm always going to advocate for you. I'm always going to keep it a buck with you. Some patients just don't care. You know, maybe they got a lot of stuff going on in their life and they just like, some patients just don't want to be here. You know, some are just like, you know, it is what it is. When it's my time, it's my time. And then they come in, get their medication, get stable, go back home. And then it's, like I said, a revolving door. But I just had to learn, I'm going to always do my part. I'm always going to advocate for you. I'm always going to educate you. I'm always going to uplift you. I'm always going to tell you, keep it real with you. I'm not going to make it seem like, oh, you'll just take this pill and you'll be okay and you go home. No, you need to go home and you need to make some real life changes. I'm just going to do my part. I'm not out here to change the world because that is just too big of a, I guess, like burden on me, because I know I'm not going to change the world. And it ultimately is up to the person. And so I would say to deal with that, just do your part. Always educate your patients, always advocate for them, and don't take it personal when they don't want to take back their health. You know, like I said, you can't want it more for them than they want it for themselves. So that is the end of the video, you guys. Let me know down in the comments if you are already a nurse or maybe you just started nursing. What are some things that you had no clue about that if you did know, you would have definitely probably thought differently about nursing or probably wouldn't have went into the field at all. All of these things I had no clue about. Literally had no clue. I didn't know about it until I was thick in it, or not even thick in it, but after you graduate and you pass your NCLEX, it's like, I'm not turning back now. And so they were just things that I just had to deal with, but things that I also found an alternative to dealing with them. So I don't want you to feel discouraged. It's definitely possible. If I can get through it, I am the most sensitive person in the world. And if I can get through it, I know that y'all can. You know, I have anxiety. I'm very sensitive. I'm very like, I want to save the world. I want everybody to be happy. And I had to just be realistic with myself. Like, girl, no, it's not happening. Just do your part. So I don't want to discourage you guys. I hope you enjoyed this video. Talk to me down in the comments. And until next time, I will see you again.